Good morning and welcome to the 9:30 call. I am coming to you live from Wellesley College, where there is the first EEC Research Summit happening. So Kim Lucas and Kyle DeMayo Cook and Wendy Robertson have planned a day. There's lots of people here, so it's great to see almost 50 people on the call today because I know there are another folks here. We are recording, so we're so excited to have Yolanda and Dodi with us this morning. Titus and Jaylise are co-hosts, so I don't know if you can also, Yolanda and Dodi, do you have slides? Yes, so great. So you should just let everybody share their screen. And I will turn things over to Yolanda and Dodi. And you know the first question we ask everybody is for you to tell us a little bit about you, how you came to be in your current role, and then we're so excited for your update.
Thank you, Amy. Thank you so much. We're thrilled to be with you and enjoy the conference. Can't wait to hear how that goes. That's very exciting. Yolanda's going to bring up our slides and we'll just do a quick update. Many of you know us at Together for Kids out here in Worcester. We see a lot of friends on the call. We're really happy to be back again with you this morning. We are a coalition of early childhood champions from the city of Worcester. We really work both regionally and across the state, but our focus is really the city of Worcester and the families with young children within the city of Worcester. We have over 200 early childhood advocates, and we are united under wanting to ensure equity for every family in Worcester so that their young child can thrive. And so we look at things like developmental milestones and the developmental continuum of care, where the gaps are. We're really system building to try to make life easier for families of young children. And among our membership, we have Parents First. We always use strategies, 1, 2, 3 strategy around who gets to speak first. And we always put parents at the center and at the forefront of all of our work. Early education and care providers come next because they're with those children more every day than families are. And then we also have early and infant mental health providers, healthcare providers of all types, lots of basic needs support providers, from food pantries to diaper banks to all the folks that are trying to help families do okay in these really challenging times. We also have advocates, community leaders. We meet with our governance council at the city level every quarter. We also work with schools and universities. We have a bunch of connections with schools and universities and have engaged students in our work. And one of the projects is the one we're going to share with you today. And we're working really hard to get the business community to be involved with what we're doing. We'll share a strategy about that in a little bit. But we operate under 4 guiding principles, and that is one, that everybody's job is to make sure that children in their community thrive. When I first met Yolanda and we were bringing her into the coalition, I said, I want that little old man on the street down the road from me who's never had children and isn't a grandfather but might be an uncle to care about young children in this community. I want him to see how it matters to him. And I think we're getting there. We just had a wonderful article published in the Worcester Guardian, and I was grateful for Strategies for sharing that. So if you want to learn more of our background, it's there. The other principle is there's no time to wait. These children grow up so fast. We know the window prenatal to year 3 is such a critical time for brain development, and we know it goes by like that. So when we're looking at wait lists of 1 to 2 years for different services, we realize what an absolute disaster that is for that child's development. We also believe that if we can get it right at the beginning, we often say equity from the start, that has a return on investment throughout a lifespan. And it has a return on investment to the whole community. We're really excited to see the new information. I don't know if folks have seen it yet, out of the Hecksman Institute about the importance of home visiting. But they just put out a study yesterday about the importance of home visiting. And so we have two major strategies in our community health improvement plan for the city of Worcester. One is high quality, affordable, accessible early education and care, and the other is universal home visiting within the first month after birth. And so we're really excited to see Heckman coming out with that home visiting information. But that's just a little bit about us. I'm going to bring my colleague Yolanda in to introduce herself and take us through the next slide. Yolanda, please welcome us.
Hi, a lot of you guys already know me. My name is Yolanda Ramos. I am Amy, to your question, how did I get into my position? Well, I am a mental health provider and I worked in early childhood mental health in my career for many, many years. And during COVID, I realized that providing mental health support for young children virtually was not that easy. And I had the opportunity to come in on board to Together for Kids Coalition and go into a deeper work in early childhood. And that's when I met Dodi and they brought me on board. And really my position has been around engaging community and families into the work that Together for Kids has been doing around Worcester.
That's great. Sorry, Kim, I didn't answer the question, so I'll do it really quickly. My first job was a babysitter. I'm the youngest of 5 children, so I didn't have younger siblings, and I loved babies and I loved small children. So I started out as a babysitter at age 12 or 13, and I knew that that was the lane I wanted to be in for my whole life. My very first professional job was as a Head Start teacher. Head Start's under siege right now, so let's keep an eye up on that. Very important to save Head Start. But I was one of the lowest paid employees in the federal government. We had a class action suit in 1980 when I was a Head Start teacher in Allston, Brighton, part of Boston. We made $7,000 a year as our salary. It has not gotten all that much better, I hate to say, but
Right.
I'm very passionate about that. And now here I am at the end of my career, and I'm still fighting for Head Start and still fighting for early childhood educators to get a decent wage.
And Dodi, if I just could, thank you for that reminder. We did learn yesterday that the Boston office for the Administration of Children and Families was closed.
Yes.
And the staff was eliminated.
Yes.
And so we are learning, Michelle Hamowitz put out a statement from Mass Head Start Association. We are still trying to understand the impact. We've been in touch with members of the federal delegation. There were other offices that were closed. I will put, there was an article in the Globe today. I'll put the link into that. And then I will post it on the follow-up folder so folks can see. So we will continue to monitor the situation and let folks know what we can do if there's anything. So thank you, Dodi.
Thanks, Amy. Yeah,
Thank you, Amy.
hot off the press, and so critically important. And so that's how I came to the work. So a little background about what we've done at Together for Kids Coalition. We really have built these two kind of products. We're really a coalition. We're really not a program, so we don't really build products. But these have evolved out of the need from our members. So one is our monthly newsletter, where we have a monthly meeting. It's a very active, very intensive meeting in terms of, it's kind of like the 9:30 call, but for our little coalition in Worcester once a month, where we all come together and learn some things together and also share updates and that kind of thing. And there's so much going on in the chat that we decided we just had to create this newsletter. So the newsletter tells people, just pay attention during the meeting. You don't have to write down all these things. You don't have to capture all these links. We'll throw them in a newsletter. We'll get them out to you in the week after the meeting. And then you have that as a document. It's on our website as a document going forward. Whenever you're like, oh, I remember they talked about that at Together for Kids. Who was that person? How do I connect? The newsletters are there as a sort of ongoing record of the resources that we're all utilizing and sharing, and our wonderful heroes. We always do a community shout out of one of the early childhood champions in our community. So that's one of ours. We actually, this past meeting, it was so jammed full of information that we're like, oh, Yolanda and I have to like go back and rethink the strategy
I
for
got overwhelmed.
how we get it all on one piece of paper, because we're determined it's only going to be one piece of paper, right? We don't want to give people too much. But there's so much to say right now, and especially as things are evolving on a day-to-day basis. So we're working on kind of restructuring it, but it's working really well.
And just to say a little thing about that, Dodi, and what Dodi's saying is there's so much resources available, and a lot of people don't know about them in our community. So the idea of the passport was really a concentrated version of the resources available for new parents. I'll go into what the Welcome Baby Guide to Resources. Sorry if I call it passport. We changed the name recently. We're now calling it the Welcome Baby Guide to Resources. And what it is we have so many great resources in our community that a lot of new parents aren't aware of. So we came out with this idea where we can provide these resources in a small, fit in your pocket, little booklet which has all the resources, and I don't know if you can see it, where parents can just, here's the address, here's the QR code, this is your contact information, this is who you can go see, show up, tell them who you are, let them know you. We have heard from some people, can you make this virtually? But it kind of defeats the point of what we are trying to do, which is to get the people out there so they can go and get to know their community firsthand.
Wonderful.
So how we came up with this idea was, I'm a mom, and first thing out of the hospital was I got this big booklet with all the scary things that could happen, all the bad things that could happen to my baby, and it was so scary and terrifying. I had this little person I have to keep alive, and all these things that I was like, oh my goodness. But I had no idea where to go and meet other moms or find out any resources or support. I used Google for breastfeeding ideas. I didn't know about the baby cafe or postpartum support for myself and my baby. So I looked for play groups, and everything I ever found was online or out in the Boston area or New York, nothing around my area. So I did mention this, and we heard from other parents in the Together for Kids Coalition meetings. They felt the same way. I didn't know either, or I didn't know that the library had some programs for new moms, or I didn't know there was a museum in the area, like the Ecotarium, where they have a lot of resources for little young ones. I didn't know I can go to a food pantry and get some breastfeeding support or baby formula. I didn't know that. So we wanted to capture all that and make sure the parents were aware that these resources are available to you, and you don't have to wait until your baby is here and you're looking for it. It's right there for you now, and you can go and talk to them, get to know them now.
It's a wonderful question, Titus. It's evolving. What I'll say is every time we show the guide, we're trying to remember to call it a guide now. We've moved away from passport because of all the immigration stress. We just thought, let's not add to that. Let's try to think of a more neutral. We're looking for a more creative word than guide. So if you have a brilliant idea, please put it in the chat. But what we found, even the woman who prints them for us, I showed it to her and she was like, where was this when I was pregnant? So many parents say that to us. Every time we show them the book, they're like, I needed this when I was pregnant. This is just what I needed. So that's the answer, Titus. Great.
So this is what it looks like from the outside. We have a QR code for parents to give us their feedback, what worked, what didn't work. Is there something we should be adding to the passport or taking off the passport, which we did get a lot of feedback, and there were things removed from the passport that weren't as helpful for the families. And then there were things added, and there continue to be more things added as we go. We just realized we need to add more things after this meeting. So there's going to be some changes. We included a guide on how to use the Welcome Baby Guide. So It's very simple. You have all that information. We used to have stamp in some of the locations, but that seemed to get really complicated. So we simplify the process. That way parents can just go get to know the people from the sites, talk to them, ask questions. And these sites already know what to expect. They know what the guide is and who we are. So they can answer all these questions and connect with families one-on-one. We included a key guide so parents know what each of these locations can offer. And I don't know if Dodi, if you want to say a little, Dodi knows how to explain a little bit better. But the language capacity was an issue. So we can't offer every single language that isn't, we have here in Worcester. There are many, many languages spoken in Worcester, but we could offer some simple pictures to help people understand what these places offer.
Yeah. So what we decided to do was we were thinking about the map of Worcester and how maps have keys. And so we created a key of icons that would allow any parent with any language capacity to be able to see, oh, there's food at this place, or there's diapers at this place, or this is a place I can take my family outside to play, or here's caregiver support. So we created this simple list of icons and use those throughout. And you'll see in the next couple of pages how that works. We also left a place for notes because there's always that little, need to scribble down what, somebody's nickname or I met this person there. But this is what the listings look like. And most of them have QR codes. We're constantly trying to update the information, but the use of QR codes is great because that means we don't have to go to everybody's website and recorrect. The websites are up to date. If we get them to the website, they're in good shape. So that's why we use the QR codes wherever we can. Great. So we have, go ahead, Yolanda.
I was just going to say, if you look at the sides, it has what the location offers for families. So if you're looking for a play groups, you see the little blocks. So you know that these little blocks will say that, oh, there's a play group. They offer a play group. Maybe I should give them a call and see what time their play groups are. We also included a big question the parents had is, where are the parks? There are a lot of parks in Worcester. Some of them aren't for young little ones. So if you scan the QR codes, it gives you the parks. They have items for little babies and young toddlers. So there's like explanation of where they are, how you get there, parking, all that good stuff. So parent can find out more information. We included that ecotarium, but then we also included some information for moms before baby is born, like the doula services here that we have in our community. Some of the bigger questions a lot of moms have is information about family leave. And so we wanted to make sure we included that information since a lot of families are very confused about that process.
That's great.
We also included some local resources, lactation support, as well as postpartum support, and places to get information about resources. So when you see an I right here, it means that they can offer a lot of different information for you. Aside from just one thing, they can connect you to other resources. All right. So I'll run, I know we're kind of short, so I'll run really quick. We offer also information about peer support resources. There are some groups in our community which are very specific for certain moms, like recovery resources for moms who are recovering from substance misuse. So we included that as well because we thought it was very important for them to also have some of those resources available to them. And then we also included the car seat resources. That's a big deal. We had, and I don't know if she is here, Michelle, who was part of the Welcome Baby process of developing this. And one thing that she worked on was on seatbelts and getting car seats in the cars, and she noticed there was a lot of families who weren't put in the car seat the right way. So we wanted to make sure that families were aware there are resources where you can go and they can teach you how to put that car seat on. And here are those resources. Here who the person who you can talk to. And some of these resources can also offer free car seats for families in need.
And of course, we have our wonderful childcare resources. Kim, I see you out there. We work very closely with our CCR&R out here in Worcester. And we all know, we've all been through it for so many years, right? I remember when my daughter was pregnant, I was like, as soon as you're pregnant, put yourself on the list. She's like, no, I don't need to do that. I'm like, yes, you do. And so the earlier people can get on those lists for early education and care, the sooner the better. So we want to make sure that that's covered. Yes, we do have mental health. We have some basic services. So our main provider is Seven Hills. So they're all over the guide. And so Camilla, I know you asked about mental health services. Oftentimes those are integrated into some of the programs we've listed, but you can also see here we have the McPAC group, the Behavioral Health Hotline, as well as some other local resources. Great. And then, so part of the building of this passport was we have a wonderful group, again from Seven Hills, that does almost bi-weekly virtual guide through email of all of the community resources in Worcester, but it is pages and pages long, and it has everything from what to do if you're losing housing to immigration support to legal services to everything under the sun, and it's wonderful. But what new parents told us was, it's too much for me, it's terrifying, I can't even get through the guide. And that's what really gave us the idea to pull out just those infant and prenatal kinds of supports. But we did put that in here. We're going to add the Spanish version as well because they do it in bilingual. And then we've had so many people, this is another place we need to update, who have helped us contribute to the passport. But the two big funding sources, I know that's going to be a question that's come out. We got a determination of need funding from the UMass Memorial Healthcare organization about 2 years ago that got us started on this project. And then we leveraged that with Hanover Charitable Foundation, which is a large insurer in Worcester. And they really provided the money for the first couple of printings and also gave us money to provide car seats, pack and play strollers to families in need. So they kind of gave us a little jump start on that, which has been incredibly helpful. So we do this in small batch printing because we know that we can't go too far down the road. So we just printed 250 and now I only have 13 left. So I literally have it right here. This is what it looks like. This is how big it is. Fits into a diaper bag or a pocket. So Yolanda, in 3 seconds, can you tell us what we're up to next?
So what we hear from families, so we had families give us feedback. What do you think about the passport? And we had a parent said, we felt so welcome by the staff at the Worcester Family Partnership. Our baby might be a little young for them, but they welcome us regardless. The staff at both Pernay and UInc were very enthusiastic about sharing the resources they offer, as well as the library. If it wasn't for the Welcome Baby Guide, this parent would have never met any of these people. Now her baby's young, but now she knows where to go, who to talk to. She has these contact information, and what we hear from families is that now I know, and that's what we wanted. So, and what's next? Well, we are hoping to work with local businesses on getting some more printed. So we are meeting with the Chamber of Commerce next week to see what kind of ideas they can give us so we can engage the community and the businesses around Worcester to getting some of these printed.
So the really quick answer, because I'm sure it's coming up, we had our original one was very pretty and very fancy and it cost $7 a piece, and we thought that's not sustainable. So we've now gotten it down to just under $2 a piece. So we're going to sell it to people as $2 a piece. Get us 100 passports, we'll distribute them for $2,000. You can get these in the hands of 200 parents. That's wonderful, right? So that's it for us, guys.
That's pretty amazing. Lots of appreciation in the chat. And then the question, you've answered many of the questions. Are there, it's great to hear about the parents. And does it include local information on childcare centers or family resource centers, tuition supports, play groups? And
Yes.
then Kim says yes.
Yeah, so we don't do individual childcare providers. We send them to our CCR&R because they're the experts. And they know who's who and who has space. And we don't want to, we don't want to send people on a wild goose chase. They're already on that. We're really trying to get
Right.
to the navigators that can help them get to the services they want without 20 steps in between.
Right. And then what advice would you have for other folks if they were interested in starting to do something like this?
Well, we're happy to share our model. We're happy to share what we've done. We do it on Canva, so it's really easy to keep it up to date, and we can send you a link. You can see what it is. You could think about what your local resources are. I would say shop around for printers because they're all so different. It took us
Right.
about 6 months to find the one that was right. And of course, the woman who saw it, she was like, "Where was this when I was pregnant?" First thing she said when she saw the passport. So find the right printer. That's the other piece.
The other thing that we've heard, and Yolanda, you talked a little bit about like it can be very overwhelming. You get a big packet of something after you have a baby. We've heard from parents of toddlers like, I think I'm ready now for some more information. So have you thought about that as well? I'm sure.
Yeah, well, so a lot of folks have said, is this a family guide? And, we're a little proprietary about wanting to be sure it's really geared toward the very first part of life.
Yes.
Be interesting to think about what's next, as you grow kind of thing. It could be a series. I think, yeah, that's really interesting, Amy.
It also, I think, really have the parents have like a person, a warm handoff. You hear
Yeah,
all the time, like,
that's the key.
now I know
Yes.
who I could call about anything. Yesterday, the coordinated community family engagement
Yes.
grantees did a legislative briefing, virtually, and they had 100 people on Zoom. They had legislators, they had staff, they had a lot of the grantees, and it was so well done. They had 30 minutes, like the 9:30 call, but a lot of, this is like another, you guys are filling a gap that exists. And so just really want to appreciate that. Appreciate kind of all the design and just like the tactical advice around printers and using QR codes.
Have a person on your coalition who's as talented a graphic designer as Yolanda. I don't know if you can find that, but we're really lucky to have her.
Well, and I think to your point, like finding the funding to support to get this out to parents in the community. So just really want to appreciate, I saw Yolanda at the 9:30 call celebration. She gave me a passport. I have it on my desk. And just really want to appreciate. So keep the love and appreciation coming in the chat. Tomorrow we're going to continue our first year tour. We have Representative Richard Wells joining us today. And we'll give an update of this, Alice Peisch is here, Leader Peisch is here, and Wellesley. So everybody here is sending their best, and we'll look for the recording. So thanks so much, Yolanda and Dodi, and we will see everyone tomorrow on the 9:30 call.
Thank you.
Thank
Have a
you.
great day.
Thanks.
Bye-bye.